very important with breast cancer women is that the vast majority of them are feeling completely well at the time of diagnosis. So the diagnosis of cancer comes as a complete shock to them. And as a consultant dealing with this, not only does one have to think about the various treatment options, but also has to be able to tailor the consultations and the subsequent treatment options to that particular patient, taking into account their lifestyle and their daily activities and all these considerations. So that the idea being to help them through the treatment, choosing the options that are right for them. And that includes also choosing the right reconstructive options, because the idea really is that they should be able to get through this treatment phase and return back to their life and their normal self-confidence as quickly as possible.
I think when you have breast cancer, it throws your whole life into disarray, and that for some people they go on to build a business or remarry or do marvellous big things, but there's also quite a journey to go on just to get back to normal, not to have the big sea hanging over you, not for your family to think that they've got to treat you with kid gloves, just to get back to a normal life where you enjoy your life as you used to. And that takes a little while, but I think I'm well on the way to there, and it's really nice to be back, just to be me in my life with my kids, my family, my friends, not the woman who's got cancer. We don't think about it now. We've moved on. Of course, cancer doesn't just impact you as a person, it impacts your family greatly as well, and it certainly impacted mine. I have 3 grown-up children, and they were all shocked, and also my husband. They try and be optimistic for you and help you, but for those first few weeks, I don't think you're the easiest person to help, because you're really trying to find your own direction, and they don't know which approach to take towards you. But they were all shocked, because you have to consider whether you're going to be facing, you know, an operation and some follow-up treatment and everything's then going to be fine, which you hope for, or whether it's going to be, I'm sorry, we'll do as much as we can for you, but you're not going to have that many more years of life. And both of them at the first discovery are possibilities until you get down the process and find out how it's going. My treatment at Princess Margaret Hospital started with a consultation with Mr. Fussell and the breast care nurses, at which time we discussed my options and which way to go. At Princess Margaret, the breast care nurses are absolutely fantastic, not only in providing you with valid information in printed word, but to give you a phone number whereby they will speak to you pretty much any time, because once you've jumped on the cancer bandwagon, it really does become a roller coaster. My stay at Princess Margaret Hospital, although you don't want to be in any kind of hospital, certainly was the best it possibly could be. When you're going through not just an operation, but something that is affecting you emotionally, they were passionate about their jobs and ensuring that their patients got the best kind of response for them. So yes, they were passionate. They were very knowledgeable. There was nothing that they didn't have a response to or couldn't help with.
Because of the amount of breast tissue that needed to be taken out in Wendy's case, simply taking the cancer out in the traditional way would have left her with asymmetrical, potentially disfigured breasts. So it was important to consider this when planning Wendy's treatment. And increasingly we know that patients do very well from breast cancer treatment, and so they have a life to look forward to beyond the treatment for their breast cancer. So we are beginning to offer these sort of complex oncoplastic techniques which not only allow the cancer to be removed, but also for the patient to have symmetry and to achieve hopefully a reasonable cosmetic result. But Wendy's future is very positive indeed. She has had her cancer treated successfully. There is no evidence that it has spread anywhere else, and she has completed her treatment. Wendy herself has been very positive throughout, and she can now look forward to leading a full normal life with regular checks.
My advice to any other ladies who find themselves with breast cancer is that whatever the prognosis is, if you put yourself in the hands of professionals who are doing this, they will make sure that you achieve the best outcome for you, and that there will be ups, there will be downs, but you should go along with that, and that you should live your life, because we all only get one life. It's not a rehearsal that you can come back and do again. And I'm sure there's some time in the future when I will look back and say there was something good in this. It gave me this, or it gave me that, or it gave me an understanding. And I think that's what you've got to do with all of life's experiences, and try and think of this as an experience to go through, not a start, a finish. It's just something you will go to, and you'll come out the other end. Perhaps something a bit different, but you will come out the other end, and just go with it. Hang on.